just getting like resources for clinicians to get a handle on. Things like that of looking at, maybe ice isn't the best practice,
right?
Especially in a chronic setting. It's just, I think for clinicians who really do their due diligence of being a top practitioner or clinician, that they always have to get into research and new concepts and things like that. Because there's some people that I meet that, ice and STEM, that's all I've been taught, and that's all that works for me, and that's all I want to do.
Or that's what I was taught when I was first in school, and, they don't have the mentality to be like, oh, who knows, there might be something bigger and better out there to do this. It's like, okay, well, back in my day, it's like, well, we're not in your day. We've made such vast improvements, why not take advantage of them?
Yeah. So I think incorporating that, information that's gathered through research, I think that's what gives us the tools and gives clinicians who, really are trying to do their best to be their best for their athletes and patients. I think that's where it's important.
Yeah, definitely. Well, and that's kind of what I agree completely with you, and that's kind of my take on it. And that's actually why I thought of you for this interview, because in everything I've seen and with other students that I've worked with you, I feel like you completely have that mentality of you want to try new things and you want to learn about everything so that you can figure out what's best for your athlete. And I feel like you are constantly growing as a clinician, and I've seen it, and it's inspiring, honestly, for me to see the different things and the different aspects that you have kind of incorporated yourself in to treat your athletes the best you can.
Thank you. Yeah, I mean, and I try. I mean, I think for me, I get so much fun at leaving messages, but I think kind of like for me, my involvement in USA track and field really opened my eyes.
Yeah,
and I think really challenged me, and at that same time, kind of getting really involved with it and getting involved with teams and trips on the higher levels, like Olympic level athletes.
Right.
Also was going through my master's program, and my master's program challenged us to think, along the lines of like expand your knowledge and looking at a term, kind of like a phrase that I've kind of adopted, and luckily I ran into an instructor that kind of made a nice little kind of coined phrase. It's like, don't chase pain, chase movement. And
yeah, there you go.
Really what I do with USA track and field, and even with Mount SAC track and field, and I do with all the chronic stuff.
Oh, absolutely, yeah.
And so looking at if I can take care of all the, the movement dysfunction, help them move efficiently, because then as an athlete, they just need to be able to move, and when they get injured, they have something that affected their movement. So,
right.
And also to the idea of getting down to the root problem. And I think some of the techniques and ideas and concepts that even for me that I was taught in school, a lot of very symptomatic.
Yes, very.
Symptoms. You're not getting down to the root, and
right.
So like if something hurts, okay, let's figure out and take care of the pain, rather than finding out why or what is causing the pain and take care of that.
Yeah.
So I think that has helped me kind of drive of looking at new things, and then also, evaluating things that I do hear that in the back of my head are like, I don't know if that doesn't kind of jive with me as far as what I know from a physiological standpoint and fundamentals and principles and things like that. So it's kind of helped me have a discerning ear to what I hear out there.
Oh, yeah, especially. There's just like a floodgate of everything coming at you, and you have to be selective on realistically what's going to be best for you and your patient.
And a lot of it is this parent, like for me, I get just, I think in the last couple of years with track, Mount SAC has been doing a lot of recruiting. And so it's funny because the coaches will bring them by the athletic training room, especially seeing some of those kids that, they're good in high school, and you can tell that they're kind of that higher tier high school athlete, but their parents are very involved, and they take them to their, massage therapist, trainer, and I've had 3 or 4 parents that come in and, I work with so-and-so, and they're great, this is what we have planned, and I listen to it. It's like, you could do so much better. And it's like, I get it, but
right.
I ask some questions to kind of open up and challenge their thinking, and even to the athletes that we do get, this is what my coach told me to do, and this is what I've always been taught. And sometimes it's difficult to break through that.
Oh, absolutely.
Some kids they're stuck in their rut.
Right.
Even when, as best as we try to explain to them. And then some kids are like, well, I trust you. Okay. And those individuals will improve. So I think that's, one thing for me, trying to be that, try to find any type of information that could help me help the team better.
Oh, absolutely. Yeah, I agree. Alrighty. Well, then the next one is, well, we kind of talked about it, but more specifically, how do you utilize EBP in the athletic training room?
Well, I utilize EBP, if there's something that's pertinent. Okay, so like, for example, we did one this past spring, and we were talking about like glute medius activation. And I remember, I think, at a Journal of Orthopedic and Sports Physical Therapy, it's one of my favorites, kind of cool research journals. But yeah, I remember from my grad school days that there was a research article that kind of did a review of all the types of exercises that help activate glute med, and looking at EMG studies and things like that. And so I try to go back and pull that, and I kind of give it to the students, and like, hey, let's try it.
Right.
So what I usually try to do is look for, if we have, let's say, a need, if we see a trend, we have lumbar pelvic hip complex issues, and kids are coming in with hip flexor problems and low back problems and things like that. And we do our movement assessments and incorporate screenings and things like that. And when we try to kind of implement protocol in the athletic training room, I try to say, well, this is what the research is saying. This is what's out there. And then if we get something new, like this past March, I did a rock tape certification course, and the guy, Dr. Priestworth, he's kind of thinks along the same lines that I do, as far as, let's look at the movement dysfunction, let's treat it using kinesiological tape, and in this case rock tape, to help with kinesthetic awareness and additional sensory input, things like that. And incorporated techniques like reactive neuromuscular training that I'd never seen before. I've heard about it, but I've never met anybody that integrated it clinically, and it was like, this is great. So as soon as I kind of learned that, it's like, hey, what's the research behind it? And then just kind of go ahead and just start cataloging, just do my search, and just do some of my reading. And then once I kind of have a little bit of the base knowledge behind it, gather through the research that I can get, or what available research studies have been done on it, then say, hey, let's try these exercises, and let's see if our clinical outcomes,
is the same
outcomes, are matching what the research says.
Right, yeah.
And so that's my approach. I really try to incorporate those two together. Because, like we talked about, if an athlete or a coach asks me, hey, what's this new thing? You're doing like exercises with bands, and you're pulling them sideways. And like, well, yeah, this is reactive neuromuscular training. I have to explain it to them.
Oh, of course.
For it to make sense.
Yeah. Well, and it's so much easier once they, have a basis to even understand it. Then they're like, okay, I'm on board with this. Let's do it. Now it makes sense why we're trying this. And it's cool, like the way that you're doing it is because you're essentially acting as their filter. There's all these things out here, and especially for you, once you get wind of something, you've taken the initiative to, experience it for yourself and figure out, okay, the literature says it worked. Let's try it and see, and if it matches up, then that's awesome. And if not, then hey, we'll try it again a different time or a different patient or something else like that.
And if it doesn't come out to like an expected patient outcome, then like the why.
Right.
And then we can look at, is it the protocol that's a little off, or do we now like look at the information, like, okay, how did they come up with the conclusion or the results, or do we look at, well, maybe how they set up their protocol or maybe the technique doesn't apply to this individual.
Right.
Which is fine. It's just now you know if you have another type of injury in another you have a similar type of injury with another person.
It may not line up.
It may work or may not work.
Right, yeah.
To show the kids that is important. I get a lot of kids that, they'll in their respective programs, they're like, hey, especially because I teach Therax and we do a lot of the therapeutic exercise and rehab. So like, well, so-and-so told me about this. And I'm like, okay, where's your article? Bring it in. So I kind of read a little bit. And then I ask the student, tell me what you think. And they give me their thoughts. I'm like, okay, let's go ahead and implement it. And sometimes the article, and I'll take a look at it, if look at, sample size, sensitivity, quality of it. Because there's sometimes kids will bring research articles. I got this, and I look at it, I'm like, really, your sample size was 5?
Exactly.
Like 3 drop out in the middle of the study. So kind of also teaching the kids because they are so hammered with EBP. And even my colleagues that I've seen who are hammered with EBP, especially with us having to do our, percentage of CEUs has to be EBP, they are like, well, I'm not going to do this unless it's, there's research behind it. I'm like, well, and this would be for me on the flip side is, I do things like cupping, fast food.
Yeah,
right. And people ask me like, well, where's the research on the effectiveness of cupping? It's like, well, in the context in which you're asking me to develop or to produce research, there's not.
Right.
Because the research behind things like cupping for, adhesions and body work and fascial decompression, that's more in the Eastern and Chinese medicine.
Exactly.
And that's been around for 2,000 years.
Yes.
So I tell my kids, and even I've had some other instructors kind of like, well, why does Bill do that? And it's fun because it gets filtered through the kids. And so I have to tell them, and, tell the kids, it's like, well, when you look at my approach of what I'm trying to do, I'm trying to help facilitate better movement.
Right.
Movement is inhibited by things like adhesions. Everybody uses Graston. Everybody uses instrumentalized soft tissue mobilization, and that's more pressure. Why not using
decompression? Yeah.
Using suction to decompress.
Yep.
It's just another way. So I have to approach that and then educate a lot of those students of, if you look at what I'm trying to do, even though you don't see it in, the Journal of Athletic Training, or you don't see it in like an American-based, sports medicine journal, because there's not a lot of people that I've seen that use it. I mean, it's getting more now.
Yeah, definitely.
More and more people using it.
Yeah.
Especially my former students, they're all.
Oh yeah. Are you kidding me? You have Chapman like cupping crazy.
Like Chapman, APU, just at Long Beach is kind of funny,
Yeah.
But and when they do it, knowing of how to apply it.
Oh, absolutely. When you apply it appropriately and you understand what your goal is, well, and that's what you're saying. It's like, yeah, it may not be in our American journals of, does this specifically work? But when you break it down physiologically, it makes sense.
Yeah.
And when your base of your physio breaking down and, applying it for that specific purpose, then why not?
Yeah. And I think that's where, especially in the EBP conversation, there are people that I've met where I don't know if they have that grasp of how to apply it.
Right.
Because I've talked to, I went down to Cypress College with Scott and had like Lorena and Kelsey came by and had some other Chapman kids and stuff like that. And it was funny because, around here, especially like the cupping and things like that, that's kind of like the new trend.
Yeah, it is, for sure.
And it's, for me, as I look at, throwing it out there, some of the kids are like, oh, hey, is there a lot of research behind it? It's like, well, in the application that we're doing specifically, no.
Right.
You won't find a lot. However, like, we just talked about, physiologically it makes sense. There may be some related, research articles kind of lending to the validity of the concept.
Right.
And so,
and you can then apply it to that. Yeah. For sure.
So, and so I try to tell, we've had, like, my track and field group this past season, we had a lot of, like, well, if there's not a lot of research, maybe I shouldn't do it. I'm like, whoa. As long as there's a good, sound physiological principle behind the protocol, like, if it makes sense physiologically, then why not use it?
Exactly.
You know? But just don't do something because, well, this is what I get. You know, if you can't explain what you're doing enhances physiological function for either, you know, tissue repair, regeneration, restoring movement, what have you, then maybe you have to rethink of why you're doing it. And so I think for me, that's how I try as best I can to incorporate the EVP portion
definitely
into my practice.
Yeah. Well, would you say, as far as, like, your, I guess, like, time of experience with EBP, do you think that mostly started during your master's program?
Yeah, I mean, because at first it was kind of funny. Like, before I started my master's program, every time we'd hear someone like, "Oh, well, this research came out here," and I remember, like, Andy and I'd be like, "Man, they're just in the clinic." I mean, sorry, they're just in. When you look at a lot of the research articles, it's in a sterile environment.
Yes, exactly.
And I think that was, for us, is like, you know, these people are making these position statements and they're doing all this stuff. And when you look at what the position statement, or this is the management strategy that you should use for whatever, you look at it and you look at the going through and reading the research, it's like, but you're in a sterile environment.
Yeah.
And for me, I just saw that as a disconnect.
Absolutely. It seems almost like, well, you kind of just write it off immediately because you're like, how does that translate to my athletes and my functional everyday life of how do I apply this to them? Because it's like, and especially too, it's like they're not actually injured, and
and it's more controlled. And
you
know, where we work in the real world, there's not a lot of control. There's a lot of factors that you have no handle on. And so when I went through my master's program, because the founding, like the first quarter or two, they really hammered on the EVP, and really
definitely
in the whole course of my master's degree, it was an online master's too. You could not make a statement, just a blank statement.
Yeah.
Like, if you said something, you better have 3-4 articles back you up. Or if you're going to be in a conversation about, you know, looking at ACL prevention and whatnot, like, you better be able to spit out those that are doing current research on it.
Yeah.
You know, and things like that, and be able to talk in that, you know, sense of having that backup. And so I think through that really taught me and showed me how to, like, okay, there is a way to integrate, you know, research to help enhance your clinical performance. So I think that was, for me, even though it wasn't like an athletic training master's, but the concept behind the program, and really that they really instilled that value of, if you're going to be a clinician out there, you know, and you develop something, you better make sure that you can back it up by research.
Absolutely.
And I think, and I appreciate that, because, you know, how we started off the conversation of, you know, these guys are coming in and doing performance bands, or like all these little, you know, gadgets and whatnot.
Yeah.
And, you know, they're selling it to the public, and, you know, how do you know that's effective? Well, you know, the press can say anything. And so we were always challenged with that. Like, to not just say something, well, I'm going to have you do this because I want you to, and because it's going to work. You should be able to tell the athlete, the patient, like, well, why does it work?
Yeah.
What are you going to expect out of what we're trying to do? Because then that's going to help them kind of understand their own body, help them help themselves. And then for you as a clinician, it's going to, you know, help build that rapport and trust.
Yeah, definitely.
So, and even with coaches and things like that. So I think, just right up to that point now, like, you know, I'm totally sold with it. So I now see how, and still developing that ability to, you know, take really good research and blend it in clinically, and really trying to show students that come in like how to do that.
Yeah. Well, and I think that's important too, because it like when you're first starting out as a clinician and when you're like as a student, it's important too, because like the students or the athletes are going to ask the student when they're doing treatments and stuff, well, what is this? Why are we doing this? And your first year, second year, you kind of have that like, I don't know, I can't spit back what I learned in class, but honestly, it should be starting that process essentially of thinking through realistically what's happening, and I should be able to explain this to my patient.
Yeah, and I think too, and this is going to be for me, this is just my little soapbox. I think for new clinicians, I think where that develops is through experience. Because
oh yeah,
when someone comes out and they're newly certified, and they're just trying to get them cemented as a clinician. And I believe it's not to the point where like you're comfortable with yourself as a clinician.
Yeah.
Then you can start putting the integration and really turning back and educating, the athlete of what you're doing, and not be nervous about it. So, like for me, that's why I always wish that in the athletic training program, even with like undergrad, that they would allow the students to rack up as much hours as possible.
Yeah.
Because that's where they're going to get comfortable.
Absolutely.
I truly believe, then they can go out and work. And they're going to have to be in those situations.
Yeah.
So, I think that ability to educate your athletes, parents, coaches, and being comfortable of doing that memory recall and integrating that into your, the talk and language in the athletic training room, that just all comes with experience.
Yeah. Well, and it also sets up, you to look good and that you know what you're talking about, but it also represents the profession very well, and it gives us some credibility, depending on, whoever you're talking to, like with the parents or with coaches, and especially, to be able to have conversations with physicians and other healthcare professionals to, hold your own in a conversation essentially and have a intelligent,
intelligent conversation.
Medicine-related conversation.
And even too, like it's funny, because I hope that we all can get to that point as a profession. But I've run into many, and they're at 4-year schools, they're at programs, and they've been there for a while. They're not there yet.
Right.
It's almost like there's one school. It's funny because it's where I teach. I teach Therex, and I have my kids that I'm trying to provide that latest information and things to think about and have them be, a sound clinician, and especially when it comes to rehab, therapeutic exercise, and program design. And then they go out there and they run into other people that they're just stuck, like we talked about, just stuck in that. Yeah. This is what I learned. Now I'm not this because it's too much work, like things like that. It's difficult, and so it's hard. Like my students come back to me like, hey, well, so-and-so told me this, and, like I work with track and field, and they said no soft tissue work, and I'm going like, huh?
Like, oh gosh.
How does that work? Like, that's just wow.
I feel like you couldn't get track and field without that.
You can't. Yeah, you can't, and it's just funny. I think. Yeah. Hopefully we're getting there. Yeah, well,
and that'll come with experience and confidence, and once they make that connection to basically, instead of coming back to you, maybe take the time to, okay, this is what they're saying, let me research it, let me look it up and see how I feel about it first, and then, present that conversation to you so that they're a part of it rather than, hey, I don't know what to do.
Yeah. So hopefully, this new generation has... students kind of get a handle on it. Yeah. And really kind of get those values. So hopefully it could be a change.
That's the hope. That's the hope. Make the world a better place. Definitely. Oh my goodness. Well, thank you so much, Bill. This has been awesome.
Oh, no problem.
It's been nice getting to catch up with you too.
Yeah, and good luck to you. So the doctor program is how many years?
It's 2 years straight. So I don't have any summers off or any breaks or anything like that. And it's all online. I was out here for classes this last year, and then now I'm just staying out here and working, and I have my GA position. So, yeah. That's awesome.
Well, good luck.
Thanks. We'll probably catch you up on these kinds of things. And, I mean, if you're interested, I'm sure we're going to be doing more of these kinds of things. I'd love to have these conversations with you.
No, totally. It's great because, like, I just had a Skype interview with Taylor Angliano.
Oh, really?
Yeah, she was doing a project for her master's and ready for